My name is Dr. Rucker. I'm a urologist in Bradenton, Florida. I'd like to talk to you about a book today that was given to me by my dear friend Dr. John Parker. This book's on adrenal fatigue. I'd like to read some portions of it. Chapter 4, page 15. Who suffers from adrenal fatigue? And by the way, the author is Mr. James Wilson. Mr. Wilson was a chiropractor originally, PhD. Anyone can experience adrenal fatigue. Every walk of life, every culture, every age. Different factors can be your job. A good example of a profession that's prone to adrenal fatigue is my profession, the medical profession. Physicians on average die approximately 10 years younger and have higher rates of alcoholism and several times the drug addiction rates of the normal population. Typically, medical students go directly to medical school for an undergraduate program. They work in residency 80 to 110 hours per week. Other areas that have adrenal fatigue are the police force, stressful jobs, middle executives, secretaries, teachers. These patients can often have Syndrome X, a complex sign of symptoms that include glucose intolerance, increased triglycerides, low HDL cholesterol, insulin resistance, hypertension, central obesity. One of the problems that occurs with adrenal fatigue is that patients can't withstand the stress that affects their adrenal glands. The adrenal glands are very important because they provide the stress response for the body. That's the concept of adrenaline. Short-term impulses like you think you're about to get in a car accident or a fight or you have fear, raises your heart rate, gives you that butterfly feeling in your body. Short-term, that's increase in adrenaline. Long-term, that causes your cortisol rates to go up in your body, and it's like a steroid, like taking steroid shots. That can cause long-term problems, and your adrenal gland can fatigue. Examples of this are lack of sleep that can cause adrenal fatigue. Examples are lack of sleep, poor food choices, using food and drinks as stimulants when tired, staying up late even though you're tired, being constantly in a position of powerlessness, constantly driving yourself, trying to be perfect, staying in double binds where you just can't win over time, lack of enjoyable or rejuvenating activities. If any of these things speak to you and you notice you're having physical problems from these areas, you could be exposed to and suffering from simple concept called adrenal fatigue. The adrenal fatigue can manifest in ways such as chronic fatigue syndrome, low testosterone, thyroid difficulties, various ailments that lead you to go to doctors, intestinal problems. So a lot of the things that we suffer and face in life come from within our bodies, and they come from our experiences and our behavior in life, and not from simple medical problems where you need to see a doctor and a pill can help solve these problems. Now sometimes, before I started reading more and understanding more, I would listen to these type of words and feel it was bunk, bullocks. And I notice on the internet there are a lot of, I call them keyboard couch potatoes. They like to write comments, say whatever they want. What's funny about that is these people are uneducated. And just to give you a little background about me, I went to the University of Virginia for college. I went there for medical school, and then I did a standard residency in surgery and urologic surgery at a Cornell University Medical Center, New York Hospital. And I did some fellowship level training at Sloan Kettering, all in the field of urology. So I'm pretty mainstream educated scientist and surgeon. So to hear me read these concepts and digest them is out of the box thinking. So I'm going to start posting various podcasts on my views and the readings that I've done, and hopefully it can help some of you. This is going to range from urologic surgery, simple urology, men's health issues, females' health issues, New Age philosophies, yoga, meditation, martial arts, chess, musical instruments. It's going to go all over the map. So I hope you gain something from the things I'll share with you over my trip with you over time. Thank you.